We're here for International Overdose Awareness Day. There's 50 programs that are participating in this day of honoring our dead and asking for change. With a $308 billion budget in the state of California, the word overdose was never mentioned once, not one time. We also know that harm reduction lost funding this year at the same time as overdoses rose.
Currently, we're in the worst overdose epidemic this country has ever seen. In the past year, over 2,500 Angelenos have died from overdoses from substances including methamphetamine and fentanyl. Fentanyl in particular, a synthetic opioid that has kind of like taken over the drug market in Los Angeles, accounts for the exponential rise of overdose deaths.
Overdose deaths in California, in Los Angeles, in my city, in my district, are a public health crisis. In LA County alone, we've experienced a 48% increase in drug overdose deaths during the first 5 months of the pandemic compared to the same time period in 2019. 48%. These startling statistics beg the question to me, when is enough enough?
How long are we going to keep doing the same thing? That's what I want to know. Like, when are we going to say, maybe this shit isn't working, and maybe we should do something different?
I am a former person who used drugs, and I'm worth the same as I was back then. I'm worth the same right now. I just happen to not use today. That's it. I'm the same person I was back then, under a bridge, using to try and cope with my pain.
Harm reduction is a basic human principle where we're meeting people where they are and helping them reach their individual goals. It's not about putting our goals on them, it's about helping them reach whatever goals they want. It's about respecting autonomy, meeting them where they are in terms of what they would like to accomplish and helping them do that safely.
I was extremely disheartened by the governor's veto of SB 57 last week. A bill that would have allowed supervised injection pilot programs in LA, San Francisco, and Oakland to prevent drug overdose deaths and to connect people to treatment for addiction. In fact, this council passed a resolution asking for this bill to move forward and asking for these sites to be placed in Los Angeles where we have so much need for them. Safe injection sites are evidence-based. They are a harm reduction strategy that works. Healthcare professionals have rallied around them because they will prevent deaths, promote treatment, lead to cleaner streets, increase safety, prevent the spread of disease, while saving taxpayers money on ambulance calls and emergency room services. This is an intervention that simply makes sense, and yet we're saying no.
We see decreases in rates of HIV, we see decreases in incarceration, we see decreases in death. And we see people like living longer, healthier lives that are reaching their goals. We know harm reduction works. It's just something we have to like implement in society and fold it into normal conversation so it doesn't become this like strange, scary concept for people. On a very basic level, medicine is harm reduction. We wear bike helmets to stay safe. We wear seat belts. We take vitamins. All of that is a form of harm reduction.
They talk, we die. They talk, we die. They talk, we die. They talk, we die.
We have thousands of people every day utilizing supervised consumption sites, and those are bars. Those are places where we go in just to drink, and not just to drink a drink, like too many drinks. You're allowed to drink irresponsibly, just for the sake of drinking, just because you're coping with life, you're relaxing, whatever happens to be. So we have no shame in it. And what happens is people don't hide. They get to have drinks and have friendships and conversation, and they're not sitting there alone feeling ashamed of themselves.
What do we want? No more death. When do we want it? Now.
Harm reduction saves lives.
Harm reduction saves lives. No more deaths.
No more deaths.
No more deaths.
No more deaths.
Yes, you can. Give the people Narcan. Yes, you can. Give the people Narcan.
I think sometimes the choices on these issues are painted in a way that enables us not to look at what are the costs of not doing this work. A few months ago in my district, we lost someone to an overdose in a porta potty. That's a human that was someone's son, someone's brother, someone's family member. That person deserved help. They deserved a place where they could work through what they needed to work through with dignity. And that is what we all deserve as humans, and that's what we all need to be fighting for. And I am so ready to be here and fight for that with all of you. Thank you all for your leadership.
We're just so conditioned to shame and blame people. We're so conditioned to look at other people as different, as bad, as weird, as lazy, as a problem. And then when it happens close to home, then it's like, oh shoot. When someone that you love or yourself, then you reach out to us because you know that we're gonna love you. And the only way to heal is to have a safe space where you can go and be who you are.
We need to do everything we can to save every life. Every individual's life is important. And I wanna support the advocacy and the efforts to move this work forward with the resources and strength that it needs.
Harm reduction is not just about us and the work that we do on the ground every day. Harm reduction is about you. We need the community to be engaged and care the same way that we care and say that we don't want to have any more overdose deaths. We can end overdose. It is possible to end overdose. What's our call to action? You can start simple. You can go to harmreduction.org and you can educate yourself. Because one of the big things that's really important for us as a society is to face our stigma, to face our judgment, and to face our shame. So we're counting on you to do your personal work inside as we continue to do our work together as a movement.